Good evening, thanks for joining us. When we set out on our roadmap to freedom a few months ago, we were determined to make progress that was cautious but irreversible. And step by step, thanks to the enormous efforts of the British people and the spectacular vaccine rollout, we now have one of the most open economies and societies in Europe. And as we've always known, and as the February roadmap explicitly predicted, this opening up over the last 3 steps has inevitably been accompanied by more infection and more hospitalization, because we must be clear that we cannot simply eliminate COVID. We must learn to live with it. And with every day that goes by, we're better protected by the vaccines and we're better able to live with the disease. Vaccination greatly reduces transmission, and 2 doses provide a very high degree of protection against serious illness and death. But there are still millions of younger adults who have not been vaccinated, and sadly, a proportion of the elderly and vulnerable may still succumb even if they have had 2 jabs. And that's why we're so concerned by the Delta variant that is now spreading faster than the 3rd wave that was predicted in the February roadmap. We're seeing cases growing by about 64% per week, and in the worst affected areas, it's doubling every week. And the average number of people being admitted to hospital in England has increased by 50% week on week and by 61% in the northwest, which may be the shape of things to come, because we know the remorseless logic of exponential growth. And even if the link between infection and hospitalization has been weakened, it hasn't been severed. And even if the link between hospitalization and death has also been weakened, I'm afraid numbers in intensive care, in ICU, are also rising. And so we've obviously faced a very difficult choice. We can simply keep going with all of step 4 on June the 21st, even though there is a real possibility that the virus will outrun the vaccines and that thousands more deaths would ensue that could otherwise have been avoided. Or else, we can give the NHS a few more crucial weeks to get those remaining jabs into the arms of those who need them. And since today, I cannot say that we have met all our 4 tests for proceeding with step 4 on June the 21st, I think it is sensible to wait just a little longer. By Monday the 19th of July, we will aim to have double jabbed around 2/3 of the adult population, including everyone over 50, all the vulnerable, all frontline health and care workers, and everyone over 40 who received their first dose by mid-May. And to do this, we will now accelerate the second jabs for those over 40, just as we did for the vulnerable groups, so they get the maximum protection as fast as possible. And we will bring forward our target to give every adult in this country a first dose by the 19th of July. That is, including young people over the age of 18, with 23 and 24-year-olds invited to book jabs from tomorrow, so we reduce the risk of transmission among the groups that mix the most. And to give the NHS that extra time, we will hold off step 4 openings until July the 29th, except for weddings that can still go ahead with more than 30 guests, provided social distancing remains in place, and the same will apply to wakes. And we will continue to pilot events such as Euro 2020 and some theatrical performances. We will monitor the position every day, and if, after 2 weeks, we have concluded that the risk has diminished, then we reserve the possibility of proceeding to step 4 and a full opening sooner. As things stand, and on the evidence that I can see right now, I'm confident that we will not need more than 4 weeks, and we won't need to go beyond July the 19th. It's unmistakably clear the vaccines are working, and the sheer scale of the vaccine rollout has made our position incomparably better than in previous waves. But now is the time to ease off the accelerator, because by being cautious now, we have the chance in the next 4 weeks to save many thousands of lives by vaccinating millions more people. And once the adults of this company have been overwhelmingly vaccinated, which is what we can achieve in a short space of time, we will be in a far stronger position to keep hospitalizations down, to live with this disease, and to complete our cautious but irreversible roadmap to freedom. Thank you very much. I'm now going to hand over to Chris to do the slides.
Thank you, Prime Minister. First slide, please. So the slides are arranged around the 4 tests which Minister set at the beginning of the roadmap. The first test is that the vaccine deployment programme continues successfully. And I think everybody in the country knows that both first vaccinations and increasingly rapidly second vaccinations are progressing very effectively thanks to the work of the NHS, volunteers and many others. So this test has been met, and we expect the rates to continue to be good as the Prime Minister has laid out. Next slide, please. The second test was that evidence shows the vaccines are sufficiently effective in reducing hospitalizations and deaths in those vaccinated. And we already have shown data that showed that for previous variants, this was true. We now have data, and some more has been released by Public Health England today, which shows data around the new Delta variant. Now, what has been talked about in the press, for people who've got symptomatic disease or could get symptomatic disease, 1 dose of the vaccine does provide some protection, but you do need 2 doses of the vaccine to provide a strong degree of protection. But once you have 2 doses, there is somewhere between a 76 and 84% reduction in symptomatic disease. Next slide, please. The news is even better for the protection that these vaccines provide for people against severe disease. And in terms of hospitalizations, the data so far, real life data from here in the UK, show that there is a very good reduction in hospitalizations from the new Delta variant after both 1 and 2 doses of the vaccines. So after 1 dose, between a 57 and 85% reduction, and after 2 doses, somewhere between 85 and 98% reduction in hospitalisation. So not complete protection, but very substantial protection after these. Again, it reinforces the absolute need to get the second dose of the vaccine. So in terms of is this dose this effective, the data there are very encouraging indeed. Next slide, please. And if you see the effect of this on people being hospitalised, whereas in the previous waves we had here in the UK, the great majority of those hospitalised were older, over 65 citizens, although there were significant numbers of people under 65, I think something sometimes not appreciated, and that's on the left. What we now have is that the majority of those going into hospital are now from younger groups, under 65, partly because this is the group in which this is spreading, and it always starts off spreading in the youngest groups, but largely we think because the vaccines are providing a lot of protection now for older citizens. But it is not complete, and as you can see, even in those over 65 in which double vaccination is already in place, there are still some hospitalizations, but the ratios have completely reversed. Next slide, please. The third test is that infection rates do not risk a surge in hospitalizations, which would put unsustainable pressure on the NHS. And the rates of hospitalizations at the moment are low. in all parts of the country, but, and this is the important but on this test, what we are seeing is a rapid rise, particularly marked where it was first really started in the northwest of the country, but the rest of the country is following. So there has been a 64% increase since last week, and in terms of the northwest, and you can see that in the dark blue colour here, and a 64% increase in England, and that rate will follow, we think, where the northwest has led. Now, these numbers are still relatively small, and if you're doubling from 50 to 100, 100 to 200, the numbers are still relatively modest compared to the capacity of the NHS. But several doubling times, relatively small number of doubling times, and you start getting to really quite large numbers. If you're doubling up from 1,000 to 2,000 or 2,000 to 4,000 over less than 2 weeks, clearly things can take off very rapidly. Next slide, please. And although the dark colours here on this map are where the rates of increase are greatest, but anywhere that is shaded in yellow or orange colours or dark brown, rates are increasing. Where they're in green, rates are decreasing. And you can see in this map that the increase in the new variant is occurring across the whole country. Next slide, please. The key question is, what does this do to hospitalisations? And as has been said repeatedly and rightly, the link between people getting an infection and being hospitalised has been substantially weakened. A much smaller proportion of those infected are going into hospital, but it has not been completely stopped. And what you can see here is that in terms of hospitalisations, again, there has been a 61% increase in hospitalisations since last week in the northwest, and a 50% increase across the country as a whole, but we expect that will probably accelerate. So there is the hospitalisations are following, but with a delay, the number of cases. So although we do not think an immediate overwhelming of the NHS is likely, if this continues on an exponential path, and in particular, if that then accelerated further due to further loosenings, then we would run into trouble in a relatively small number of doubling times. Next slide, please. So the final test, and really this has been led up to by the things that have happened previously, is, has our assessment of the risks been fundamentally changed by new variants of concern? And what this slide shows is, in the orange is the numbers of cases of the B117 alpha variant that had been the one that dominated in the UK until very recently. And that has continued on a downward path, and although it's probably stabilised a bit in the last couple of weeks, nevertheless, if this was the variant we were primarily dealing with, I think it is very likely that ministers would want to continue on the current path. The problem we have is, in the dark blue, what you can see is the Delta variant, the new variant, and that is, whilst the B117 alpha is going down, the Delta variant is going up, and currently going up exponentially. And just to make a point, the area in the grey shaded areas, the data are not complete. Those will carry on going up as data come in over the next weeks. So this is the reason why the assessment of risk has fundamentally shifted. At the end of the period that the Prime Minister was talking about, we will have a situation where a much higher proportion of people have been double vaccinated or vaccinated. We're coming up to the school holidays. We all want to stress that at that stage, rates will be higher than they are at the moment. But the next 4 weeks will reduce significantly the risk of a very high peak, which could cause significant problems in terms of pressure on the NHS and all the knock-on effects of that, and direct deaths from COVID. Thank you very much.
Thanks very much, Chris. Patrick, anything to add to that at this stage? Okay, fine. Thank you.